Democrats have been given a powerful mandate by the American people to take the next step on Obamacare. But if they win this November, will they be the dog that caught the car? We're talking to Democrats. We're talking Obamacare 2.0. We're talking healthcare with our very dear friend, Sy Mukherjee. Sy is a veteran healthcare reporter and a senior communications strategist when it comes to life sciences, medicine, technology. And we're so happy to get his unfiltered, his banker bill take on what's happening in healthcare right now. And I'm especially honored to be able to talk to Sy about this at this moment in time, because Sy and I go all the way back to the first Obama campaign.
We're going to win so much, you may even get tired of winning.
Are you expecting a recession this year?
I hate to predict things that way. There is a period of transition. It takes a little time.
Sy, the way I just see it right now, it's spectacular that after we, 3 shutdowns where the American people always sided with the side that wanted to keep the government open. And this last shutdown, they explicitly stood behind the Democrats. They actually stood behind the Democrats longer than Chuck Schumer did, right? Explicitly because they wanted the Obamacare subsidies extended. That's how much America is on the side of Obamacare. It took almost 20 years. And to me, the way that politically what that sets up is 2 things that the Democrats cannot screw up. In addition to trying to extend the Obamacare subsidies, they should probably do one more small thing in 2 years, assuming that they retake the House, retake the Senate. And then by the time 2028 rolls around, by the time that primary is already in full swing, we need to have a very clear idea of what's going to come next. There's a lot of ideas floating around: public option, Medicare 2.0. And within that political frame, I want to ask you, is there one small thing you would add to the Democrats' wish list after Obamacare subsidies extensions before they have any opportunity to take back the White House?
There actually are areas where Democrats can unite with Republicans and like business leaders. And we've actually already seen examples of it. And one of the basic things that they can start with is breaking up the toll booths that sort of frame the vertical integration of healthcare, right? And the biggest way to do that is to break up the vertical trusts that kind of, institute the links of the healthcare supply. There are all these monopolies, essentially. I would call them cartels, that integrate hospitals, pharmacy benefits, insurers, and they're all owned by like 3 or 4 companies. UnitedHealth Group owns doctors, hospitals, in the largest insurance provider in the entire company, in the entire country, and the largest like pharmacy benefits manager in the entire country. That's all in one company, right? And that's just insane. And like the amount of moral hazard and basically, and really like anti-competitive risk that comes with that, like it is astounding the effect that can. And that's something that Democrats should really just pick up and go for. And there's actually a bill on the table right now that I think should be a centerpiece of any Democratic campaign. And it is a bipartisan bill. It is called the Warren-Hawley Act, right?
Wow.
And
There's a combo for you.
Right. And it is something that has strongly been endorsed by Mark Cuban, because he also has seen like what this vertical trust has sort of done to the system of healthcare, and what the perverse incentives are, what the anti-competitive sort of consequences are, and how that ultimately just like kind of like makes this fucked up system where it's like you're expected to be a consumer of healthcare when it's literally just like cloaks and daggers by a bunch of people that own every link in the chain, right? If we don't break that underlying structure up, nothing else is going to change. That is something every Democrat should run with, because not only is it like just logical policy, and logical economics, it is something that they can actually claim legitimate, like, bipartisan grounding and business community grounding because of stuff like what Mark Cuban is.
I got two things from your soliloquy there to start us off. We don't have a healthcare market. We have negotiated monopolies by these for-profit entities. Okay, you named some of the healthcare companies as some of them. And those healthcare companies, to be fair, do have an obligation to pursue profit in the market that we're in. Okay, nonetheless, it is a market failure. I think that's what you're getting at. You're also saying that if we only subsidize healthcare without lowering the costs, we are inflating demand into that broken system of a market failure.
Healthcare is not just like good or bad for like an economy at large. It's good for certain ledgers. It's corrosive for others. So the question that we're really like trying to measure there, and I think what you're getting at is like, whose economy are we measuring, and where are the costs being shifted through to, with the trade-offs that are like intrinsic in that design. Right? So like there's both like a human rights argument here and an economic design problem that's sort of designed into the infrastructure of healthcare. Like something might be good for an insurance company or a PBM, something might be good for a household ledger, something might be good for a patient, something might be good for a taxpayer, right? It's sort of like a system of allocating the risk of just having a human. So those costs become corrosive economically when they actually distort that market, when they become wage suppression, when they lead to household debt, when they lead to administrative exclusion. And if you think of it even from a more broad frame of like a scientific lens, public health capacity, right? Like what are the trade-offs between that and like the consequences of when you cut those systems and all of a sudden you have a pandemic and you don't have the institutional capacity to actually deal with it, right? So I think like that's the main frame, I think, is anytime that you're talking about the trade-offs and the market of healthcare, you have to understand that this actually is something where there's no way to avoid the trade-off. So the question then becomes, who are you actually valuing? Who are you trying to protect? Where are the costs coming from? Who pays for it?
Well, we can want people to get MRIs that they need, but those MRIs shouldn't cost the United States multiples of what they do elsewhere.
Yes, absolutely. I think that's one of the key things. I mean, you know what? I'll give you a personal answer. I'm someone that has a chronic condition, right? A serious chronic condition. When I go to a hospital, the first question that I get asked when I'm checking in is, give me your credit card, and here's how much you're going to have to pay. And then you ask, wait, why? Why do I have to pay that amount of money? And they're like, oh, this is the anticipated cost of the care that you're going to get. There is no actual economic logic behind what that anticipated cost is. And also, by the way, it is bullshit, because I know this because I'm someone who's versed in the world of healthcare, but all you can literally just tell them, no, I refuse. And they're not going to be able to turn you away because that's actually illegal, So this is just like a system where they're kind of making up these numbers. Hospitals especially are some of the worst abusers of this, because they have these opaque systems that are called charge masters, that basically are these smoke and mirrors numbers for like, oh, this is how much this condition costs to treat, or this procedure costs to, and then like that's how much it costs if oh, by the way, there's someone from a different hospital network who's involved in your care team. And then that adds like thousands of dollars because they are not part of your insurance. And this is all just so opaque and so like kind of fundamentally made up that, there is no actual economic logic behind it, right?
Well,
And
and so,
that's why we
but you're saying there's no economic logic behind it because there's too many players and too many of them are self-dealing, or not necessarily self-dealing, but have sort of monopolistic relationships to one another. Bill is sort of acknowledging that there is no market, that this is sort of a regulated situation. If that's
Monopoly,
the case,
yeah.
if we've already given up on market forces being the solution to this problem, to getting us to a place where we finally don't have to talk about healthcare every single election, then why aren't we just going to Medicare for all? Why aren't we all just going to single payer? If we're already admitting that any sort of attempt to sort of figure this out internally is going to devolve past the point of being anything close to resembling a free market, let's just consolidate all of our negotiating power and negotiate the prices down as little as possible and have a very simple provider and client relationship between pharmaceutical companies, between hospitals, between doctor groups, between MRI like clinics, and Medicare for all.
Yeah, the problem with that is, and that has been sort of the dream since sort of some of the
For
first,
who? Clarify. Dream for who?
I would say it has been the overarching goal of what the American healthcare system was supposed to provide for people, that started with, with LBJ, right? And FDR, and then LBJ. With the establishments of the various, Medicare and Medicaid systems. Now, the problem is the way that these systems were developed were kind of this patchwork accident of like history that just happened, on like a stepwise basis based on the current needs of the time, right? It worked for a large part of the population when those programs were first designed. And that's exactly what like Medicare and Medicaid were designed to do. They have consolidated negotiating power. They ensure that you have a basic access to care, right? And that you don't have to pull out your credit card, for like every single thing. And there's not this fee for service system where there's this complete opacity to like how these things get charged. That's then also federated across a bunch of like private, right? But we don't live in that world anymore, right? We have a much larger population. We have a much older population. We have a much sicker population. And so then those costs between all of those various players, they become more and more sort of inequitable across the population. And when the costs of something like healthcare and like getting your disease treated becomes inequitable on that level, then there is an inevitable economic fallout from, because what if you pay for your own healthcare, right? Because of all these private operators that is sort of working within all of this stuff, then are you going to be able to go to work? Are you even going to be able to get out of your house? Are you actually going to be able to spend anything in the like broader like commerce market? Like those are all things that ultimately get affected downstream because of these various structures. So Kobi, I'd say that, yeah, like Medicare for all and concentrating that negotiation power it's what every other country does, right? We're kind of the only country that has this bizarre system of these various private entities that are vertically integrated in sort of monopolistic trust-like fashions, but also with no actual underlying market logic, But I think the problem though is that there is still this like stigma around like socialist healthcare, right? What's funny about that though, because you know what, if we even go back to the Obamacare example or things like that, when Obamacare was first passed, it had all of these opponents being like, this is communist, you know, this is Leninist, Marxist, whatever. And Obama at that time, he actually wanted a public option in the Affordable Care Act. He said that ideally he'd want a full-on single-payer system. He had a supermajority in the Senate, you know, and he couldn't get that passed because Democrats were opposed to it. Now, we've come a long way from that, but I think, like, the thing is, there's still such a stigma around the idea of socializing.
No. We're not planning for defeat anymore. We got to stop it. If you got a plan and you believe it, you got to get out there, and we got to let the primary solve this problem. If you believe in your plan, go run in a primary, run it into the ground. And if it's the right idea, we'll either get to it then, or we'll have to come back to it later. I think that's the lesson that we've learned here. And for me, it's not the socialism thing. That's why socialism is popular now. That's why we now have democratic socialists winning major elections, is because they overplayed their hand on that. Now, yeah, as somebody who's been to Europe, I don't think anybody involved here is really a socialist. Like you've said, if you're to the right of FDR, spare me. And everybody by definition is on this issue. But Banker Bill, I want to ask you, do you think that there is a market solution that still bears some weight here? Or are we just essentially picking our poison when it comes to choosing the kind of healthcare market that we're going to have? Are you going to stand up for capitalism here, or have you given up on it just like the rest of us?
I don't think
when it comes just to healthcare, excuse me.
Yeah, I don't think there's a silver bullet on the table at this point, but there's a dozen 10 to 15% improvements in the different cost structures that could add up. I definitely agree that hospitals are a main culprit. I think that they are about 30% of overall spend. They confuse us in their rates. They confuse us in the charges and the services offered, et cetera. And I think the reason for recent interest in Medicare for all in the United States, why that has gained in some popularity versus, a generation ago when Obama was president, is because voters feel the cost pain at the ER or at a hospital broadly, and the coverage gaps are felt acutely by way of healthcare bankruptcies. And those type of healthcare bankruptcies can almost feel like a death in the family, the way that news spreads and how impactful it is. So unless we're going to pursue regulatory reform by way of something like the Warren-Hawley Act, right, to ensure that these monopolistic behaviors that in the market are, eradicated from the market, it's going to be hard to have any change, whether or not there's Medicare for all or not.
For me, like a thing that I'm thinking about really strongly is Tegvir on our housing episode completely changed how I think about questions like this, right? Because when we talked about public housing, he basically said, look, you guys need to stop trying to trick the pandas into having sex. You need to stop trying to pit the different organizations just against each other so that the perfect market conditions emerge. Either we want to pay for healthcare or we don't. Either we want to build housing or we don't. We need to stop thinking about it in terms of trying to coax the market into doing our work for us. So for Banker Bill, if you're already saying, look, this is monopolistic, this isn't market driven, the hospitals are the problem, why is this is the solution to regulate the hospital out of doing bad things versus saying, no, all of the negotiation power, all the leverage, we're going to assume it in the federal government's hands, and we're going to negotiate the price for you, and that's how we're going to force you to cut out all this opaque pricing.
What's the question? I mean,
but the question is, you seem to be saying we need to pass a law that disallows the hospital from pricing opaquely. And I'm saying,
yes.
Well, why don't we?
I also don't think hospitals should be for-profit entities, as a matter of substance.
But it wouldn't. Don't the socialists have the answer on this one then? If we want, isn't the best way, instead of trying to make a law about how they have to do pricing and then going to court and then having to close all the loopholes and well, let's just stop it. Why don't we just negotiate with them directly?
I don't disagree
Okay.
with that. I think we should be negotiating on prices.
I got
And
Banker Bill of
that's
Medicare for all.
especially,
Baby.
well, not necessarily Medicare for all. There's caveats to that, but in broad strokes, sure. And I think you saw the Biden administration go after drug prices, right? You saw the $35 insulin cap, and you've seen Donald Trump continue on some of that. You know, those are both popular.
The reason it's difficult to get straight to that is because all of these various institutions and players have become sort of like this bizarre sort of self-eating snake over the course of the last 50 years, that doing it immediately is going to cause a lot of problems. You know, you're going to disrupt a lot of care at the time, which is why I think, and I agree with Banker Bill on this, that breaking up the monopolistic trusts has to be the first major thing that we focus on. Because without doing that, we can't get Medicare for all. It's not possible to do it, because all of those links in the chain have been eating themselves for so much time. And there is so much opacity in that market that if you don't at least do that first, then just saying that, oh, this is the source of the capital that funds healthcare and negotiates power, it is not going to be possible. You know,
step one is the DOJ sues CVS and breaks up CVS.
CVS is the last mile player in.
Forget about CVS. Then what's a better example? Who's the company we got to break up?
UnitedHealth Group. Immediately.
Let's all be on our best behavior, because we don't want history repeating itself. But
UnitedHealth Group, again, how can you have one company that is the largest insurance company in the country, also has the largest pharmacy benefits manager, and that also owns 60,000 doctors? Like, that is ridiculous. That needs to be broken up.
They would tell you that scale lowers costs and for their consumers. And what I would say back to you is, for the last 30 years, the consumer price index for hospital and related services has outpaced the consumer price index for all consumers, the headline rate, except during the come out of the pandemic and the Ukrainian energy crisis with Russia. Otherwise, for the last 30 years, that's what we've seen. And I'm coming from the monopolistic standpoint because of that observation. You cannot outpace general inflation for that long without being able to exercise a incredible market power against your customer for what is an inelastic good in healthcare, right? So we're all getting fleeced by it.
There's also so much other insidious stuff that's like sort of related to this, because like there are very basic things like the paperwork that you have to go through the various entities that UnitedHealth Group owns, right? And the average Joe probably can't navigate that with like a lot of knowledge sort of built in, because, I mean, if you've ever filled out that paperwork, I think you probably know what I mean, right? And then not even know that there's like all these other different players that are playing in the background, and they're passing it off as efficiency, but really what it is kind of like rent-seeking, right? And so that's the major problem, which is, again, why I think Warren-Hawley has to be the first step, you know?
I just want to show you guys a quick point here on what people are feeling and why they're so frustrated with healthcare and why they may be willing to try something so dynamically different than what we're used to in the country. The blue line is the CPI year over year for hospital and related services. The dotted line is CPI for all items. Right? You could see here that except during the 2021 period post-pandemic, hospital and related services has consistently outpaced. This is monopoly or monopsony in action. This is the frustration of voters over 30 years of not seeing anything get done.
Excuse me then if this is a stupid question, but if the hospitals are making money hand over fist, why are we constantly having to fight over protecting rural hospitals?
Because Medicaid has been cut to shreds,
I would
the
add a couple
Supreme-
market reasons in there as well, which are low patient revenue, right? So not enough patients coming through. There's drivers for that. People leaving, right? Moving to population centers. There's those hospitals, rural hospitals have been falling behind because of compounding effect, where regional or specialized urban medical centers are getting patients for special procedures that otherwise may have gone to rural hospitals. And then ultimately, there's just high operating costs and fixed overhead to run these hospitals with an aging population, hospitals that may be 50 odd years old or older.
So hospitals in urban centers are making money hand over fist, but hospitals in rural areas don't have enough patients to keep them going economically.
I mean, I can't tell you that for sure, but I can tell you that the rural hospitals are closing because people are leaving. They're not able to get the revenue, and their overhead is very high. And unless they get subsidies, they will close.
Here's another way of asking this question. Everybody's miserable. Everybody's paying too much money. Who's making money? Who's happy with this system? Who's the system working for? Like who, like when we talk about the big evil forces that are protecting the status quo behind the scenes, which players are we actually talking about? Or is it just these monopolies? Is it just the Uniteds of the world?
It's funny you mention this because as we're having this conversation, the healthcare sector operating margins for the S&P 500 healthcare sector are at the lowest they've been in about 10 years.
All right. Okay. Sure. Yeah. Everybody's feeling it, I'm sure.
Everybody's hurting. We're all bearing the cost of this inflationary environment, Kobe.
So then isn't the solution just more federal money?
Yeah,
No.
just print the coin.
It's not just more federal money.
Thank you, Sy.
If you take a look at the Fortune 500, look at the top 10 companies, right? You've got CVS in there, you've got UnitedHealth is number 3. You've got McKesson, which is a drug distributor, which is yet another middleman in this link. One of the funny things, and I think it's something that people are coming to realize, and it's one of the things that has driven, like Mark Cuban's efforts, with what he's doing with cost plus drugs and sort of the attack on PBMs, and the Warren-Hawley bill as well, is realizing that actually of all of these players in the healthcare supply chain, pharma is actually one of the less important. Like, they actually are not like a major sort of like exponential driver of costs. It is by far hospitals and these integrated vertical monopolies that control like the drug distributor, the insurer, the PBM, and also own a bunch of hospitals and doctors.
So you're talking about the physician group or that that these doctors are employees, full-time employees of the organization?
No, they own the health systems.
Yes. Okay. I just
So
wanted
they're
you to
paying the
clarify
doctors as paychecks. Is that what we're saying?
Well, yeah, because they own that health group.
Are we then saying like the single person in the next administration who is going to have the biggest role to play in getting healthcare costs is actually going to be the attorney general?
That's also an interesting question because there's actually a few ongoing cases right now under the Trump DOJ that are targeting not just for-profit hospitals, but actually also the non-profit hospitals, because there's a whole other sort of like perverse system that's going on in that realm where like nonprofit hospitals have been able to shape this system where insurers will not like provide insurance to people or like coverage to people who don't go through the nonprofit hospital system. There's actually a case going on in New York right now with New York Presbyterian by the Trump DOJ attacking this exact issue.
It's a size point here. I read just last week about a proposed settlement between the DOJ and an Ohio health company where the DOJ was challenging the company's anti-competitive contract restrictions.
In 2024, which I think is the most recent year that we have numbers for this, total U.S. healthcare spending reached $5.3 trillion, right? That was 7% more than 2023. That's 18% of GDP. Hospital care alone, out of that, was $1.6 trillion.
Too much. If you're going to do Medicare for all, you got to hit that hand in hand. That's insane.
I think there's a really interesting 1-2 punch here, which is that the Banker Bills of the world are saying, like, we can't turn the federal funding spigot on for a system before the system's fixed. And to a certain extent, so I hate to put you in the position of our advocating for Medicare for all. I think your views are probably going to be much more complex than that. But I think you're saying, yeah, there is actually a lot of really great work that can be done, and it can be on this anti-monopolistic track, which is not something I think that has explicitly come up in this conversation. We've been talking about public option versus Medicare for all, but in a sense, we're giving people a very constructive way of punting that conversation perhaps to 2028 by saying, actually, let's focus on breaking up these monopolies now. But if the Trump administration is doing that, is that something that the Democrats need to ramp up, or is that something they need to really continue? Is Trump in some ways actually, is he on the right track with this, and we just need to keep that part of it going, or are they kind of half-assing it?
Can I take that? I think the edge is that there's nothing from the Republicans that they've ever advocated as an alternative. They don't. I mean, the Democrats, like yourselves, you have Medicare for all as a pitch, among other proposals. Fine. Last I saw, the Republicans, their big ideas are, let's make it another account for you, as if I don't have enough of those to manage. I just got my Trump account established, by the way. That's another account. I guess they're going to make another account for me. So let's not go down that road.
I think there's also like an inherent problem in that sort of market design system, and why, like, again, with the Medicare for all sort of position, and this is where I ideologically, yes, I do think that's ultimately the solution, right? Is that there is this conception that somehow you can make healthcare a consumer market where, like, you can window shop and you can do these things, and you can, like, treat it like it's a brokerage, or like an account, and like you just have to manage your money and manage your health in the right way. That's not how a fucking human works. That's not how it works. And and the system is it just gives you too many grifters who are just making money and jacking up prices in between every single lane, to actually make an effective consumer market like something that works. I do believe, however, the first thing you have to do is you have to break that system. That is the only thing that is gonna lead to something like Medicare for all. And so I think, like, the way that if you're a 2028 Democrat running, that's how you got to frame it, is we're breaking up the trusts. Go full Teddy Roosevelt on it, and that's something that's going to unite a shit ton of people, and including Republicans, as, Warren-Hawley sort of shows. Donald Trump, I mean, honestly, Donald Trump doesn't actually understand anything about healthcare, so I don't think that really, like, matters at the end of the day. But getting people like Hawley, even like people like Cassidy, who got, like, well, he got screwed, but they actually agree on breaking up those monopolistic trusts.
No, you making me having to look up something where I have to go have positive opinions about Josh Hawley is really disturbing me. Unfortunately, that is going to be my assignment for this week. So it looks like we're losing the light with you. I want to just ask one last question, and I don't ask this from a perspective of devil's advocate. I really want to be asking this question from not throwing the baby out with the bathwater. Nobody on this call thinks very fondly of Trump. Is there something that the Trump administration 2.0 is doing on healthcare that we absolutely need to keep doing when, hopefully, if and when Democrats take back over?
I'd say the stuff they've done is the most basic possible things, right? They have built a little bit on Medicare drug price negotiations. They've actually kept Biden's policy, that he originally, formulated, and that's going to be expanded, right? But I would say that even, like, I hate to say something good about RFK Jr., but I would say at the very least that whole MAHA movement has identified actual issues with chronic disease sort of like problem with healthcare and how economically consequential that is and how important it is to your business, right? I'd say that price transparency is something that the Trump administration has done. But again, these are all just like directionally good things that are like the very basic first steps, you know? They've also simultaneously undercut a bunch of stuff, right? Like, and so in that way, it kind of becomes like shifting risk, and they've weakened all of these institutions that sort of control public health across America. They've cut all of these benefits that people have. So even while they're doing some things that are directionally good, they're also undermining other things that are like critical.
No, we're asking the question at the end so that nobody has any misconceptions. We think Trump's been awful on the economy. We think Trump's been awful on healthcare. But I think he's doubled down on the negotiations. We need to keep doing that. Price transparency, always a good thing.
PBMs.
But I don't think anybody looked at their healthcare premium up this year and is worried about giving Trump too much credit. Again, I just want to make sure we're not throwing the baby out with the bathwater. Sy, thank you so much for joining us. Look, this is how I think about this issue. I want to live in a country where if somebody has a great idea for a company, health insurance isn't the reason they're not starting that company. And I think that healthy people make better decisions than unhealthy people. The question just becomes though, like, is the health insurance, are they fucking up? Are they messing around, or do we just need to spend more money on this thing? And it sounds like there's a lot of inefficiency, I'll call it, that we can cut out from the system. Sy, any last words? Is there any one thought you wish that voters would start taking into the booths with them from an expert's point of view? One thing where you might think, what's, instead of socialism versus not socialism, what frame would you ask them to use into the ballot booth?
Because of how complex the system is, it's very, and we've seen this over the course of this conversation, there's 10 billion nuances and so much like technocracy versus ideology and like how those two things conflict. It's very, very difficult to explain that to a voter in a very plain term, right? If you just use sort of moral language, then you're kind of missing out on what the practicalities of the trade-offs in the system are ultimately going to be. But if you only use the technocratic language and those, sorts of things, then you're kind of going to be ignoring human suffering and human dignity. I think that's the frame that should be presented to voters, that healthcare costs are a risk allocation system and not just with prices. And that whenever a politician is trying to tell you like, oh, I'm going to cut costs of healthcare, you should immediately be interrogating, who are you cutting costs? Who are they getting shifted to? Is that fucking me over? Is it advantaging some random middleman that has no business even existing in the healthcare system? And just remember that every single healthcare efficiency argument eventually has an actual human body attached to it.
No, I think that's really important because to me, so often this debate devolves into I'm doing what's right for humanity. I'm doing what's right for the economy. That those are the opposite sides of those arguments. But no, every serious argument proposal on this topic is going to come with both an equal measure. And so I think to the voter, it's not, they have to find a way of trying to hold both of those thoughts in their own heads. But more importantly, how do you separate the bad faith proposals from the good faith proposals? Look to the people who are trying their hardest to talk about economics and humanity in equal measure. Banker Bill, any last thoughts from? Yeah,
I'd say you focus on the folks who are going to talk about the trade-offs, not so much the solutions. I don't see a lot of that. I think that's part of the problem. Those debates that are going to be about the trade-offs rather than about getting power, right? I think the continuation of the drug price negotiation is about doing the right thing, not necessarily about political power for the sake of power. That's what I'd add. I'd say the last thing maybe is that on the drugs, the negotiation isn't about paying less. It's deciding how we allow companies to charge those monopoly prices and for how long. And that touches on Sy's point about the allocation measure and then circles back to my point on the trade-offs.
Well, thank you so much, Sy, for joining us. Thank you, Banker Bill, as always. Thank you for listening to Is It Bad for the Economy? Please send it to a family or a family friend or other person that you want to, involve in this conversation, that you want to bug with this conversation, just like Sy and Banker Bill likes to bug me and vice versa. We'll be with you in 2 weeks with another full episode. We'll try to sneak a mini episode in last week. Thank you for everybody who checked out our quick reactions to Kevin Warsh's first Fed meeting.
I was shocked by the response to that short that you did. I thought it was very well executed by you, by the way.
Some people really appreciated a 10-minute episode after an hour-long episode, so I hope they appreciate another episode that's close to an hour this time around. But thanks again, everybody. We'll talk to you soon.
We're going to win so much, you may even get tired of winning.
Are you expecting a recession this year?
I hate to predict things like that. There is a period of transition. It takes a little time